Now I will explain with an anatomy. MRI is mid-sagittal. The brain has the image of the brain. There are many anatomies in this image. The upper part of the brain is white. This is the bone. This is the subcutaneous fat of the skin. The upper part of the brain is the skin. The lower part of the brain is the bone. The black part of the brain is the bone. The lower part of the brain is the white part. The lower part of the brain is the skull. The lower part of the skull is the brain. The frontal lobe is the brain. The upper part of the brain is the frontal lobe. The upper part of the brain is the frontal lobe. The lower part of the brain is the cerebellum. The upper part of the brain is the brainstem. The three parts of the brainstem are the midbrain, the pons, and the medulla. The upper part of the brain is the corpus callosum. The frontal lobe is the genus. The frontal lobe is the sphenium. The lower part of the corpus callosum is the lateral ventricle. The upper part of the corpus callosum is the subplate. The lower part of the corpus callosum is the gluteus medialis. The medulla is the cervical spine. The two parts of the corpus callosum are the cervical medullary junction. The cervical spine and the medulla are the cervical medullary junction. The brain has some coronal images. The brain has some coronal images. The upper part of the brain is the superior celestial sinus. The upper part of the brain is the superior celestial sinus. The lower part is the gray metal. We know that the outer part is the gray metal, but the inner black part is the white metal. The celestial image of the corpus callosum is the coronal view. Here is some vein, internal cerebral vein. This is pineal gland. This is cerebellum. This is fourth ventricle. In cerebellum and muscle, fourth ventricle. This is sigmoid sinus. This is venous supply. Now, what are axial images? This is T1 axial. This is flare axial. This is T2 axial. Now, if we compare T2 and flare. The two are mixed. The white metal of the brain is dark. T2 is dark and flare is dark. Gray metal is on the outside. It is brighter than T2. This is the mix of these two. The most different thing is that the fluid of the two is black. The color of CSF is black. T2 is white. This is the main difference between flare and T2. CSF is black and T2 is white. T1 is also black. So, T2 is black and T1 is gray. T1 is black and T2 is gray. So, one of the differences is that the white metal is bright and the gray metal is dark. So, this is the image of the brain. Now, what are axial images? This is T1, T2, and flare. All three are axial images. There is a pathology on the left side of the lateral ventricle. T1 is like this, T2 is like this, and flare is like this. If it is like this, then we need a contrast star. If it is like this, then we need to see the diffusion image. If it is more than 100, then we need to understand that this is a stroke. I can say that this is a stroke. I have been saying this since I was a child. If it was a tumor, then the tissue around it would have an effect. The tissue would be small, the tongue would be here, and the tongue would be here. If there is a tumor, then it is a tumor. There is fluid in the brain tissue. If there is a tumor, then it is a tumor. It is okay to use other parts, but it does not matter. I can say that this is a stroke. There is another image. T1, T2, flare. This is T1, T2, and the player. Now we have a diffusion-weighted image. After this scan, we will get 3 series. 3 series will come in one folder. The first diffusion will be the value of B value of 0. Another B value will be 1000. We will print this 1000 series as a diffusion. Another will come ADC. We don't print ADC. We print ADC if we want radiologistic. With one diffusion scan, these 3 series will come. In this 3, we only print B value 1000. Now we will get diffusion. If the diffusion has a stalk, it will be white like this. With the stalk, it will be white like this. Here we can see that the B is a small stalk. In diffusion, the stalk is very good. The stalk is very good. Here we can see that there are multiple small stalk. There are multiple small stalk. Now we can see the diffusion-weighted image. The stalk is very good. As we can see in the T1 image, there is a high point signal on the left side of the brain. The signal is a little dark. T2 is a little bright. We can see that there is some kind of a jam. After the diffusion image came, we confirmed that this part of the brain is stalked. This part of the brain is not working. The tissue of the brain is not working. Because of the stalk, the tissue has been destroyed and fluid has been released from the tissue. Because of this, these are white in the diffusion. Now how does ADC image help? ADC image is that the diffusion image is shown as white. But in ADC, it is black again. And by comparing these two, it is confirmed that this is actually a stock. If there is such a white in the diffusion, and there is such a black in ADC, then it is confirmed that this is actually a stock. There are different time limits for a stock. After a stock is made, MRI is done. After 24 hours, 7 days, 30 days, it is shown as white. The more days it takes, the less the diffusion will be shown. ADC image will be white. And the tissue will be hyperenters. We can see in the flare that there is a rupture of the rupture. It is shown on the right side. And we can see the diffusion that it is a very large area. And the area in ADC is black. It is dark. And this is confirmed. Now there is a hemorrhage. After 10 minutes of contrast, the class will start again. It will take another minute. This hemorrhage is shown as a GRI image. If there is a hemorrhage in the GRI image, it looks like a black ring. And the hemorrhage is shown as a black ring. If there is a microhemorrhage, it is shown as a black ring. Since there is iron in the hemorrhage or blood, iron is a ferromagnetic metal. That's why there is a dark signal in MRI. Now there are different stages of blood. There are different stages of blood. Blood follows different stages of bleeding. At one time, the blood is in one group. There is a hemoglobin. In this group, the blood is shown. It is shown in T1. It is shown in T2. It is shown in GRI. It is shown in GRI. It is shown in D1. The next stage is hyperacute hemorrhage. There is a MRI done in less than 12 hours. But then it comes like this. Another stage is deoxyhemoglobin. It is an acute hemorrhage. It is 2 days after 12 hours. In this stage, the MRI is done. It is a deoxyhemoglobin stage of bleeding. At this stage, there is an ISO intense in T1. It is in T2. T2 and flare and GRI. Dark signals are found in all of them. Then there is methemoglobin. At this stage, intercellular bleeding occurs. Then, it lasts for a week from 2 days to a month. At this stage, the bleeding is shown in T1. Only in this subacute stage, the hemorrhage is shown in T1. And the rest of the protocols are shown in dark. It stays like this.